A heart murmur is a sound made by turbulent blood flow within the heart, heard during a heartbeat. There are two main types, innocent and abnormal. Innocent murmurs are common and harmless, often occurring in children or during pregnancy due to increased blood flow. Abnormal murmurs may indicate underlying heart problems. Causes of abnormal murmurs include congenital heart defects present at birth, such as holes in the heart, septal defects, or valve abnormalities. Acquired conditions can also lead to murmurs, including valve calcification, which narrows valves or valve prolapse, where valves don't close properly. Infections like endocarditis can damage heart valves, leading to murmurs. Other factors include anemia, which causes increased cardiac output, or hyperthyroidism, which raises heart rate and blood flow. Diagnosis involves listening with a stethoscope and may require further tests like echocardiograms to determine the cause and treatment. While many murmurs are benign, some necessitate medical attention to manage underlying conditions.